Welcome back. In the chapter of preventive medicine and obstetrics, pediatrics, and geriatrics, in today's session, we are going to discuss about the under 5 mortality rate or the child mortality rate. So, you see here under 5 mortality rate. Under 5 mortality rate. What does it mean? Mortality is what? The death of the children who are aged under the 5 years. Death of children aged under 5 years divided by the total number of live births in the same year per 1000 live birth. We are taking per 1000. We are measuring it is expressed or measured at the rate of 1000 live birth. So the rate is taken here. So under 5 mortality, when they ask the question under 5 mortality, you have to write mortality is what? The death of the children less than 5 years of age in a given year by the rate. When they ask the rate, you have to write number of live birth in the same year per 1000 live birth you're considering. Again, you can see the formula here. Child mortality rate or under 5 mortality rate is the number of death of children less than 5 years in a year by the number of live birth in a year. So you see that we consider the number of live birth in a year per 1000 live birth. You're expressing at the terms of 1000 live birth. So into 1000. In India, there are 36 child mortality rates per 1000 live birth. 36 child mortality. 36 children aged 1 to 6 age less than 5 years. 36 children less than 5 years are dying out of this 1000 live birth. If you consider 1000 live births, out of them 36 are dying. Next, globally, we see globally. In India, it was 36. Throughout the world, globally, when you consider, it is 6 million. It is 6 million per year. And as we studied in the infant mortality rate, when we were doing the infant mortality rate, we studied that the single best indicator of the socio-economic development and well-being was the under 5 mortality rate. It is the first best indicator of the socio-economic development. You can see 5, you can remember it as socio-economic development. Okay, under 5 mortality is for the socio-economic development. To understand the social status or the social indication, we have the previous video what we studied, that was 1 to 4 year mortality rate, and the infant mortality rate stands second in terms of socio-economic development. Clear, guys? I will tell you again. Under 5, the under 5 mortality rate is the first best indication for the socio-economic development, and the second best indication for socio-economic development is the infant mortality rate. Then what about 1 to 4 year? It is for the social indicator. It is a social status indicator. That's all. Next, the neonatal condition that leads to 47% of the under 5 mortality. So we know under 5, what all comes under 5? Birth to 28 days is a neonate, right? Neonate, in that early neonate 1 to 7 days. Late neonate is from 8 to 28 days. So we have early neonate, late neonate. What are the things we have? Birth to 28 days. Then 28 days to 1 year is a post neonate. So now the neonates they contribute to, that is from birth to 28 days, first 28 days, they contribute 47% of the under 5 mortality. So we see that first year, second year, third year, fourth year, under 5, out of this, in the first year, the neonate 0 to 28 days, the neonate contribute about 47%. Okay, the 47% of the deaths are contributed by the neonates. And what are the causes of this neonatal death? They are prematurity, the most commonest cause. We have already studied this in the neonatal mortality rate. Let us revise now. The prematurity is the most commonest cause. And the low birth weight baby, prematurity leading to low birth weight baby weighing less than 2.5 kgs. And the preterm births, normal term is 37 to 42 weeks, the baby which is born preterm, before the completed term, if it is born preterm baby. Also, the babies who are having certain infections, that is acute respiratory infections, we have also the other in respiratory infections like pneumonia and influenza, then asphyxia is another cause for the neonatal deaths, where enough oxygen exchange is not occurring, leading to the death of the baby. Next we have the prevention and control. Now, before going to the prevention and control, I would also like to tell you some of the other causes globally when the integrated child management and childhood illnesses. When the integrated management of childhood illnesses, that is IMCI, they address the most principal causes for the child mortality. They include the diarrheal diseases, acute respiratory infections, measles, malaria, malnutrition. Added to the neonatal conditions, we also have malnutrition, diarrheal diseases, measles, malaria. And we also see that worldwide, the leading causes of the death among the children who are aged under 5 years include pneumonia, compromising 12%, and we knew the other conditions like preterm birth complications, diarrhea, and the intrapartum related complications. Intrapartum, that is during delivery, the complications could be gestational diabetes, hypertension, gestational diabetes leading to big baby, eclampsia, and there could be malpositioning, or the feet coming out first, or the breech presentations, the presentations could be wrong, the labor could be obstructed. All of those complications can also lead to the death. And that is under 5 only all this comes, right? The intrapartum, preterm complication, diarrhea, pneumonia, also this meningitis, guys, which is almost 2% of under 5 mortality rate, 2.1%. Meningitis is also seen one of the major cause. And then tetanus, injuries, neonatal sepsis, all of this. Neonatal sepsis we have already studied in previous video, where there is infection of the blood by the bacteria. Neonatal sepsis. So these are the other few causes which you can list down. Now when they ask the most important causes, that is 47% is because of prematurity, preterm birth, infection, asphyxia. In addition to this, you can write diarrheal diseases, malaria, then what else did we study? The tetanus, neonatal sepsis, then the preterm complications, intrapartum complications. Preterm complications are preterm births and prematurity. Then you can write down preterm, no need. You can write down the intrapartum complications, meningitis, and regarding this IMCI. And IMCI also gave certain causes, under which we have this measles, malnutrition. All of these causes can also be added if you have a short answer to write. If they ask a short answer, you just can't mention these 4 causes. In addition to this, you can also mention all the various causes I said: measles, malnutrition, diarrheal diseases, accidents, meningitis, tetanus, sepsis, etc. So all of this can be neonatal sepsis, all of this can be written. Next, we move on to the prevention and control. How can we prevent and control the under 5 mortality rates? So, the first thing what you can do is added neonatal care. Now, we know the neonates contribute to 47% of the total under 5 mortality rates. So, first thing you can add is the neonatal care, where there is effective interventions for preventing the death and for improving the growth and development of the baby. If the baby is suffering from diarrhea, you can give the oral rehydration therapy. If it is suffering with sepsis, give antibiotics. Even for the pneumonia, ear infections, you can give antibiotics. Then if it is having malaria, give anti-malarials. Vitamin A supplementation. All of this can be done in the cases of neonatal conditions. And we also see the other things. What are those? We have the case management and health education to the mother. If the health education is given to the mother, half of the problem will be solved. the babies can be, healthy, if the mother is taught about the proper weaning, the importance of colostrum. And in rural areas they discard the colostrum, the yellow milk which is discharged for the first 2 days, they discard it, which is absolutely wrong, because the colostrum, it is known as amrit, it is known as, you know they consider it to be very, very, very useful. It contains all the antibiotics and rich supplementations what the baby requires. All of the antibody anti anti the immunity providers, antibodies, all of this will be there. We have gamed, right? We had studied that IgG, IgA, you can do it like this, GAMED. The colostrum will contain IgG, IgA, IgM, IgE, and IgI. So all IgD, all of these antibodies will be there, and immunoglobulins, and we have so many other things which will be transferred to the baby from the colostrum, from the mother's colostrum to the baby. So you have to educate the mother. And case management, and I told you about the case management. In cases of diarrhea, give ORS, oral rehydration therapies, and so on. Next, controlling the malnutrition. If the mother's malnutrition as well as the baby, see, the mother's malnutrition, by educating the mother to have an additional, the lactating mother should have additional calorie in their calorie should be added in their diet. And also the baby's growth should be monitored by the growth chart or the road to health chart. If you measure the weight of the baby against the age, if the weight to age chart or the growth chart or road to health chart, which we have discussed already, when we monitor the growth and we control the malnutrition in the baby is going towards the malnutrition, -3 st. So we know all of this. If the baby is going below -3 st, if is severely malnourished, or if it is going towards malnutrition, we have to control it. And vaccination has to be given. The vaccination schedule has to be strictly followed by the mother. And promoting breastfeeding, so we know exclusively 6 months breastfeeding has to be done and also the vitamin A supplementation, very important. You have to tell the mother regarding the importance of the breastfeeding, and what are all the artificial feeding, the what are all the disadvantages of artificial feeding, and how the babies are at risk. When we studied the risk infants, we saw that artificial fed, bottle fed babies are the risk infants. So the breastfeeding is very important to prevent the mortality, under 5 mortality. So breastfeeding has to be done, exclusively breastfeeding for 6 months, and followed by the 6 months. 6 months you'll do breastfeeding exclusively. From the 6th month onwards, 7-8 months, and up to the age of 2 years, the breastfeeding along with protein rich supplements like the boiled vegetables and fruit pulps, all of that can be given to the baby. Next, we have an MCQ which we found in the previous question paper. The denominator in under 5 proportionate mortality rates includes the total deaths in the same year, not the live birth. So a very tricky question they had asked. Whenever we see the under 5 mortality rate, we mark off as the total number of live birth. Wrong. They are asking an additional extra word. You can see here, under 5 proportionate mortality rate. If they ask under 5 mortality rate formula, we know it very well. When they ask under 5 proportionate mortality rate, when they ask the proportion, they are asking out of the total deaths, what is the proportion of, okay, proportion of the, out of the total deaths, what is the proportion of under 5 mortality rate? So obviously in the denominator, we will take the total deaths in the same year, not the live birth. Okay, simple, clear. So I hope the under 5 mortality rate is clear. And if you have any doubts, put it in the comment section. And if you like the video, hit the like button and subscribe.